Welcome everyone, and I hope that you will enjoy this. So when I was asked to do this session, I was thinking of doing something else. So I'm going to tell you now a love story, and as you can see with the title, When Publication Met Practice, a love story, it is actually a love story that I'm going to tell you, but I'm also going to highlight some contemporary issues or thoughts that I have, well, not issues that I have with, but thoughts that I have with regard to publication and practice. So I first want us to do a Mentimeter. So if you have your phone, you can take a snapshot of this QR code, and then there's a question that will be asked. Can anyone just give me, you probably still need the QR code, ne? Let me do that. Just take this. Ooh, already. Okay, somebody got in. Do you still need the QR code or are you fine?
Maybe put it in the chat.
That's a brilliant idea. Let me put the QR code. Let me do it this side. Sorry. QR code, copy. Let's do it. Chat. I like doing something like an icebreaker beforehand. There you go. It's in the chat, so that we can just get the juices and the interaction flowing. And then I would like to do this. Okay, and we present. Okay, so the question is, have you or are you in the process of publishing an article? So we are 27 people in the room, and we have people that says no, and then there's people that says yes, and we already have 7 out of 9 participants who responded. So I'm going to give another minute just for everyone to get the QR code and get logged into Mentimeter. We have still 9 people. Okay, so from this we can see that from the 9 people that participated here, that most people did not yet publish or are not in the process of publishing. Now I want to go to the next question. I want to know, where are you currently working? Is it in clinical practice? Is it in academia? Or is it maybe somewhere else?
Lizemari, can you just maybe press send in the chat so that they can see the QR code or the link? Some people are asking for that.
Sorry, guys. Sorry. Excuse. I was wondering why there's only 9 people. Okay, so we have 3 in academia, we have 1 in clinical practice and 1 in other. 4 in academia. Oh, we have 11 participants, 12. We have 14 participants, 11 voted. We have 15, 16. I'm just going to go one back. I just quickly want to see here. Majority is still no, and then this one is 9. So majority of our participants here are in academia, and they haven't published, and then the second is clinical practice and others. Okay, thank you for that. I just wanted the indication so that I know who I'm going to speak to and where to put the emphasis on. Okay, are you still okay? Can you see my slides again?
Yes.
Brilliant. Okay, so I'm going to start this session off by telling you a story. Once upon a time, there was a princess. Her name was Practice. Practice ruled a kingdom called the clinical environment. The kingdom, however, was complex to manage and was in an under-resourced area of the country. She often had challenges with policies, finances, and physical and human resource constraints, often which affected the community's well-being and health. She was desperate and needed help, but who would save her? Then, not so far away, there was a brave prince called Publication. The prince was blessed with wisdom and had a beautiful voice. With his beautiful voice, he sang of his wisdom. But the prince was held captive in a tower and was only allowed to sing to the king and a selected few. So the king and the selected few always wondered where Publication got his wisdom from. Little did they know it was from the 5 blind mice that visited him during the night, telling him about the kingdom not so far away. The prince wanted to help, and as the mice reported on what they had seen, the prince would give them ideas to share with people in the kingdom by asking them their perceptions and experiences on challenges the mice had identified. And in other circumstances, the mice were instructed to do surveys to collect information. But publication's wisdom was never enough to satisfy the king's need, and he always wanted more. So a desperate prince instructed the mice to conduct low-quality research to keep the king satisfied. So with this story, the 5 blind mice, and not that we are blind as researchers, but I thought of that we use them to represent how we create new knowledge on contemporary issues in nursing sciences. And when we look at where we get this information from or this new knowledge from, it's usually the researchers in academia. And as we saw from the audience, most of us are in academia. We get it from our master students who enroll in our programs, our PhD students. And then we also see that there's a bigger focus on research in our PG DIP programs that is now being accredited by SANC. And we can see that in the core modules that they are presenting. And then to a lesser extent, there's also a research component in our undergraduate programs, but not all of them always get published. So this is basically now representing the population of our creation of new knowledge. So I have a few thoughts on the matter of publication. And the question is, will the king ever be satisfied? If we look at scholarship, and especially with publication, we see that we are now in a digital age of publication, and publications are being published much more quicker. There's more frequent release times within publications. So I was also an editor for a national journal, and there's quite a lot of pressure on editors to produce or to get more articles out. And we can actually see it with the number of articles that's actually coming in. So we see that knowledge is actually being produced much faster, much quicker. You working on a project and then you see, oh, shucks, there's already a scoping review on something out already that's sort of surpassing your research. So there's this faster knowledge turnover that's happening. And basically, it's the digital technologies that are altering the core research activities, such as information creation, the storage, and then also now that we're talking about the dissemination. And you will see that a lot of my focus will be on the dissemination of research or of knowledge and how we approach our scholarship. So in academia, all of you are actually familiar with this, publish or perish. So in academia, your publications, citations are being used for institutional and also personal performance. So if you want promotion, you need to publish. If you don't publish, then you won't get promotion. And then also the universities are very vocal about being research-led universities, which also put pressure on the academic staff to publish, to get a higher student intake and so on and so forth. And then, like I've said now, the increase of postgraduate students is also a focus for universities. And this led me to the idea that sometimes we then shifting the focus on why we do research, that we just do research for the sake of this pressure that we have to publish, and we actually don't care what we publish as long as we publish, it's quite concerning, because if you look at the contempt or the complex issues that we're dealing with, like now that was explained in the kingdom, that we sometimes, because of the issues that we have there, we have to have more rigorous research, and it takes longer to do that research, but we need 2 years to finish a master's students, a minimum of 2 to 3 years for a PhD student. So there's just this whole snowball effect that we have within publication, and all then perish. So also what I've seen a lot of times, and this is now also personal experience being a supervisor and graduating students, is that there's good research, but it's not being published. And one of the things can be a lack of momentum. And what I see here a lot of times is, I can think of 3 of my master students who finished in the past 2 years, that they have their degrees and they don't, want to publish because it's extra work. They've done what they need. They can show that they do research and they want to move on with their lives. So that lack of momentum keeps a lot of the research then in dissertation phase, and it doesn't go further into publication phase, so that it can go further into clinical practice. Or what we see also within our PhDs is they do something and then they leave it. It doesn't go on. So, or it's not implementation style, it's just verification and then we stop. So there's also what I've seen, and this has also been highlighted by literature, is a decrease in motivation. So I have a friend who's working in also a nursing education institution, but a private training institution. And she said to me, but Lizemari, I'm not getting any incentives for this. So why am I spending hours doing research and writing articles if I'm not going to be, incentivized for that? And then also one of the other causes for not publishing is a lack of confidence or support. I do not know how to write an article, is what I've often heard, because writing an article is totally different from writing a dissertation. You have to have a certain angle. It's much more, I want to say, it's a different style of writing. And people can think it's difficult. So if you ask a student for a first draft or for an article, then they'll usually come with a summary of their copy and pasting their PhDs or their dissertations. So this is one of the issues why we don't see publications of good research that has been done. And this is basically, okay, so this is the result that I wanted to mention, is if there's no publications because of these reasons, it diminishes that opportunity for the kind of professional dialogue and knowledge building that we need to take nursing forward. And I think a lot of times this is why we are moving all towards the thesis by publication, to get the information faster out there, so that there can be knowledge built, be building on each other's work, and it creates that professional dialogue. Then another one, and I think that came actually very clear is because of this pressure to publish. So if I can take you back to the story, publication was now just doing research for the sake of research. And what I've seen is, because of this quantity versus quality, that we sometimes have lower quality research that is being done for the sake of academic performance or obtaining a degree. So for instance, a lot of supervisors will say, well, they just have to show that they can do research. But my question is still, what type of research are we doing? What I've seen is single methodology studies is not acceptable anymore. I've seen with international journals, they want mixed method studies. They want more complex intervention studies, and we'll get to that a bit later. So single methodology studies, is also being pulled into question. There's a big question regarding literature reviews for master studies. Is it acceptable? A lot of people say no. I say, well, if it's still a methodology that you need to apply, and there's still knowledge creation, there's still an analytic process that needs to happen, there's still that critical thinking that needs to happen within this, and this creation that needs to happen from your findings. So it's just a different type of methodology, but that is now my perception. Then also low or small population samples is also an issue. To do a study on the experiences of 3 nurses in the Karoo is not going to be published. People are not going to look at that. So that's also one of the things. Also with quantitative research, what is a big enough sample is also now being questioned. And then, as I was actually alluding to, is the so what research. So it has been done before, so so what? So for instance, if I can give you an example, on clinical learning, that is my specialty. So I, for instance, look at preceptorship, and somebody said that they did a study on preceptorship the one day, and I said a master study, and I'm like, okay, so what did you see? And nothing new arose from their study that isn't already known within preceptorship, because it was just, again, the experiences. So it's the same thing, a lack of support, consumables that's not available, all of there's a lot of things that's just similar. And we have to rethink the way the topics that we are choosing and that we want to research. So we also see that a lot of times students come to us and they say, I want to do this. And then when you actually talk to them and you go and read and research, then it's like, guys, but this has already been done. So we have to really think of the novelty of the research that we want to do. And I'm going to, so this is just the issues that I'm highlighting. I'm going to share with you in a short while what I see as possible solutions on how we can do better in research. Okay, so I've also looked at some studies. So this is actually a study that I wrote with Champion and Yoni and Yvonne Botmai. If you are in nursing, you will know them. They are quite renowned. So we actually looked at the doctoral contribution to nursing sciences in sub-Saharan Africa. So what we did, we did a document analysis, and we had 166 documents that we looked through, and we saw that only 17% of the studies applied nursing theories or models or frameworks. And the rest of the studies were from other disciplines. So if we're talking about taking nursing forward, why are we borrowing from others and we're not creating our own? So that is one question that came from here. The contribution to nursing science from doctoral studies were also very poor. There was a low uptake of nursing models in doctoral research in the sub-Saharan Africa, which may significantly contribute to the lack of refinement of nursing science within sub-Saharan Africa. So you can see just from this one study that we have to really think of what we publish, and this goes beyond the theme of beyond publication, that we actually contributing to our own field, which is nursing education. Then the tower. So as I've spoken or talked a lot now, but if you look at the love story that I'm telling, that I told you about, and that we read about, there was this tower and this selective few. So publications in peer-reviewed articles are only available to a selected few. And I have colleagues that's in clinical practice, and when we're working on projects, they will say to me, but Lizemari, I can't get an article. I'm struggling to get articles. It's all blocked. I know, and I acknowledge it. If you look at the third point, that open access journals, so journals started actually opening the access, but it's also limited. So there is a movement to make it more available to the public or to the profession, if we can call it like that. But also the main reason for why we see this collective few that can have access is because of the institutional capital and business models of the journals. So that is one of the reasons. So I want to go on now with the next part of the story. So one day, while Practice walked through the courtyard, the princess heard one of the blind mice speaking to a resident of the kingdom. She stopped and listened for a while. She stopped the mice before he could leave and asked him about his conversation. The mice told her all about his findings and about the prince not so far away. Finally, an answer to her prayers. She immediately summoned her horsemen to take her to the king and the prince. She begged the king to have access to the prince's wisdom, telling him about the challenges she faces. The king felt compassion for the princess and agreed to release the prince. Now, this is now where I want to get into knowledge translation, and I don't think I've seen Petra, any of the others that wrote this article. It was a systematic review on the barriers and enablers. Sorry, this is not Petra's, this is somebody else's. The systematic review of barriers and enablers and strategies to embedding translated research within public hospital system, focusing on nursing and allied health professions. What was concerning about this article was that there is a significant time lag, approximately 17 years, between the collection of research evidence and its publication into everyday practice. And this is a quite recent, I see I didn't cite it here, but the recent cited article. And if we talk about knowledge translation, it's knowledge that we created through research that's being translated to practice. And as you could see, that there's a lot of things happening. If we also translate it or draw it back to the story, a lot of research is being done in the clinical environment, but it doesn't reach the audience within clinical practice. And I think that is one of my biggest concern is the research that we do. Yes, we go to conferences and we present things there, but my question also now within national and international platforms, who has money to go to conferences these days? So we see within universities, the budgets are being cut. So you have to look for your own source of funding if you want to go to research places, research conferences, sorry, not places. So there's this whole shift within the academia platform because of financial constraints and that we need to also consider. So if we can't attend conferences, if we can't attend symposiums, what can we do to still disseminate our knowledge so that there's still knowledge translation? I'm going to go to almost the last part of the story. So the prince immediately ran to the tower, and as she approached, she could hear the sweet voice of the prince as he sang songs of wisdom. She came through the door, and as their eyes met, it was love at first sight. So now I'm going to share some of my thoughts with regard to moving beyond publication. So I've highlighted the issues now that we have within publication, getting them to clinical practice. You know, if we talk about knowledge translation, I think, number one, we need to rethink our co-authorship. You saw that because of these constraints that the prince was doing his research, instructing others that on reports that they have heard within clinical practice. But we need to move beyond that. We cannot do our research without practice. We need to be in the clinical environment, observing, working with partnership. So that means, for instance, if you have a public hospital group, is to actually engage with them and say, what are your needs? Because who knows best what their needs are than the people in clinical practice. And I saw from the audience that there's only a selected few in clinical practice. So we have to move towards, I think, a hospital or clinic or nursing home or whatever based research units. I think we really have to start working into that type of research units to actually make a difference within the clinical learning environment. Because why do we do research? It's to change clinical environment for the better, to make sure that our patient outcomes are better, that people are employees are happier in the that there's a not happier is not the right the scientific word. Let's say a positive practice environment if your interest is within that area. So I think one of the things that we should do as academics, we should move towards hospital-based or let's call it healthcare facility-based research units so that we can be directly among the issues that we can help. Then to move beyond publication, I think that there's a call for more rigorous type of research. I think we should move away from single site or single methodologies, like for instance just qualitative, quantitative, but more towards a mixed method approach. I've actually seen some of the universities for the masters and PhDs that let's keep it with master studies that I have assessed that they are moving towards mixed method as well. So they'll develop something and then they'll verify it, for instance, to put that extra leg to it. Also, I want to add this. Sometimes what I've also seen is when people do mixed method studies, we call it bologna slicing. I don't know if you've heard about that, but you sort of take this mixed method and then you publish the quantitative leg and the qualitative leg. And I think it gives I don't want to say a skew picture, but it gives a single-sided or uni-sided picture of the study that you've done. Whereas if you combine the two, it's much more comprehensive and much more substantial. Implementation science research. For PhDs, intervention type research, that's the way to go. We will have to start looking at implementing actually something, because we can't just stop. And I'm speaking to myself because this is how I've grown as a researcher and as a supervisor and as an academic, is that we should move beyond just developing something and then leaving it, because then the uptake will be less in clinical practice. And that's actually where we want to make the difference, or where we should make the difference. So yeah, that's one of my thoughts that I had. I also looked at, and this is actually Petra, if you all know, from UKZN, and Shirra, she's from Malawi. We're working together. She's from St. John's of God on intervention research. So what they did is they did a scoping review to see nurse-led medical surgical knowledge translation, but they specifically looked at interventions. And they saw that there is not a lot, especially in the WHO Afro region, intervention research being done. And the reason why we want things like intervention research is that we can promote that evidence-based knowledge, skills, and behavior within both urban and then rural clinical settings. So this is where we all have this beautiful words, and you've all heard it, is evidence-based practices. So, but if the knowledge and the publications does not get to clinical practice and there's not a jointedness, then evidence-based practice will fall flat. And another thing is, you can't say it's evidence-based practice just because you've done one study with 3 nurses in the Karoo. It's not evident, and then you give recommendations and then you say it's evidence-based practice. I'm sorry, I disagree. That's not evidence-based practice. Okay. So moving beyond publications, again, I want to suggest that we look at cohort groups or peer writing groups. I think I have a colleague that always say we have half-written articles. I have several half-written articles on my laptop as I'm presenting this. And the thing with peer writing groups or cohorts, it gives you that sense of I want to say you're not alone. So it gives you that support, that sense of support, number one. Number two is it's dedicated time that you sit and write, which is very important, because you start with something and then life happens, and then you have to, 2 weeks later, you have to pull all the strings together, and it takes you 3 hours just to remember where you were when you last wrote it or started with the article. So that is the other thing that we need to also look at. I also think that this is part of the support will be to bounce ideas from one another, or to say, this sentence reads funny. I don't know, something is wrong here, because sometimes something is wrong, but you don't know where the issue is. So it helps when you have somebody that can quickly read through your work and say, you know what, I think you should do this. It really helps with that discussion and that, keep you going, that motivation. And then mentors who understand academic writing. Like I said, academic writing is a skill. It's something that you learn. I'm in academia now, so my first article was published in 2018. And so since then, I've published not just with other people, over 20 articles. So it's a skill. It feels like only now I can sit down and I know precisely, how to write. The background was the worst for me. Not the background, sorry, the discussion was always the worst for me. And now I'm actually getting to a point where I feel, okay, I get the hang of this. I can do this. So it takes a while to get into that mode of writing. So surround yourself with mentors, somebody that has done this before, that is well published, that they can help you the tricks or the trades to actually do that. Or get somebody in if there is finances for that. Especially in academia, I know that we often set money apart for somebody like that can help us with the writing. And now I want to get to the last part of my story. So they had a beautiful wedding and they were very happy. A few months later, they welcomed the birth of their first son, who they named Evidence-Based Practice. The end. So what I wanted to bring to this conversation is the fact that we have to be more deliberate in how we do our research so that it can move beyond publication. And it's only with that, I want to say, marriage between evidence-based practice and, not evidence-based practice, practice and publication, that we can move into evidence-based practices that can inform how we do research or nursing practices, and that can involve our nursing practices. So with that being said, I want to thank you. There is 15 to 20 minutes left for any answers or any questions or any discussion. Remember, if you want to share your thoughts on this, please, I welcome that. It should be a place for discussion. So I'm going to give over to Lizelle and then let her moderate the next part of the session. Thank you. Lizelle, over to you.
Thank you so much. I can give you a round of applause because you spoke so many things that has touched a nerve and myself, and I recognize myself in quite a few parts of your love story and in the examples that you've used. Sue is going to actually manage the question and answers, but I just have one question that I want to ask to you, is to bring into context of the series that we've done so far. So on Monday, we talked about education, leading in education and practice. And yesterday we had Werner talking about AI, changes of AI. So do you think that AI could actually be a glue that help us stick practice and scholarship together for real impact? Or do you think there's a risk that AI turns into a bit of a third wheel that sometimes look good on paper but might actually make it harder to connect research and practice in our day-to-day lives?
Don't ask easy questions, do you, ne?
Using AI to help with formulation of the questions.
So, there's a big, if we look at publications, so a lot of publishing houses now have clauses in with regard to the use of AI during publication. So if we take it a step back, I would say the thing is you need to find out where the research problem is, because that is what we start with, is what is the problem? And then from there, we build it out. So what is the research question? And then, we build it out. So I don't think AI can give you the research or the research question or the gap. You need to go and look within clinical practice, what is the issue? Now, moving beyond that is, why not use AI and say, how can we solve this? to get ideas. But the thing is, you need to use AI, and it comes back every time with every discussion. And I'm sure Werner, because I know Werner as well, said use it responsibly.
Yeah.
We have to use AI responsibly. That's how we need to use it. So I have, for instance, I saw a proposal the other day where a student, and I could see the AI because I'm using AI to get ideas, and I think there's a place for it in academia, just to get that juices flowing. And she, for instance, used sections that she used AI in her proposal, and I'm like, guys, what are we doing here? And I think that's the question, and I don't think I'm going to give you an answer today, that we need to ask is, when is it okay and when is it not okay?
Okay.
Because the thing is also, what I'm thinking is, and if we pick up AI, is it Grammarly is also AI that we use to formulate our, whatever, our dissertations or whatever. We use Grammarly for this because it's a language model. So the question, I think you have to ask yourself that, well, number one, you have to go to clinical practice and see where the gaps are. Once you identify the gap and you want to know what you want to do, then I think you can ask AI, listen here, which type of methodology can work for this? And it will spit out a few things, but it will still require you to go and think, well, yes, this can work. No, this can't work. Yes, this can work. This can answer the research questions on. So with regard to AI, I think it can help. But it cannot take over, I think, where the issues are within clinical practice, because we are human and we work with human people, well, obviously patients. So that part, I think AI will not be able to tell you what's the issue there. You have to get that part. So it's a bit of waffling that I'm doing here. So when somebody's saying something, but they also not sure, I'm waffling. So that is my opinion, and that is how I use AI. So to give ideas, but when I write, I make sure that it's not AI's work, it's my work.
So
But
you
I mean,
use it.
it can help.
So you use it as a glue, bringing things together, and it's a support. It's not there to take over. I like that. So thank you so much. I'm going to hand over to Sue to lead the rest of the discussion.
Yes, thank you very much. I only see one comment in the chats. Lizel, I don't know if there are any on the Padlet, but Rina has raised this issue about publication fees can be a major barrier, especially for those outside formal academic institutions and those without grant support. And I know you, Lizemari, you mentioned a colleague of yours who works in the private sector, and this is a huge problem for them because there's no mechanism in the private nursing education establishments for funding publications. I wondered if you had any brilliant ideas for getting around that problem.
So what I've done, because I know we have money and I have grants for previous work done, I would pay because I know they can't pay. So I, as an academic, will pay. So we still get the research out there, the publication. But I mean, that's not sustainable. Like I said, if we go to conferences now, I mean, the budget is seriously cut, especially international conferences, where we are expected as academics to compete on if you go to associate professor and professor if you want promotion. So we have to think differently about this. And I'm wondering if this isn't where us as academics, and I know we are quite a lot here, is starting. We need to have these conversations with editors and with publishing houses and say, but how can we get this out more easy to the people? And I'm not just talking about, going and giving a talk as a webinar about your research. I'm talking about the actual publication. But I think, because you need to be published. You need to show evidence of that. And I think we should, as academics, should drive this conversation with the publishing houses and with Kirashi winners. I mean, let's start national. Kirashi winners, I don't think one of us is with iJans. But we can have a conversation with iJans because Nelouise is there and say, guys, but how can we, if we can prove that it's for clinical practice, how can we circumvent this issue? So I don't have a clear answer for that, but I think as academics, we should advocate for clinical practice, for the people in clinical practice. I think they can have access to that co-authorship that I talked about. I think this question is now more towards the major fees for those outside. So I think the co-authorship can actually help with that, because there is a certain amount that we can pay, and we have open access in I know, for instance, as UFS, with certain journals we have open access. So I think that co-authorship will, and if you work together with practice in a certain setting, that can actually be the bridge. But how they can get the information, or let's say we're doing it on cardiovascular disease, on something in the ICU, then and we work together with it, they have the access from the university side, but we're also making that direct contribution within clinical practice. They get the knowledge as well, because we're doing that co-authorship. And then obviously publication will be from the institution side, especially if you publish open access, and the fees are waived, because I know that we had a few journals that some of the fees were waived. So I think that is, as academics, I think we should drive this, because we are I want to say, the custodians of the publications most of the time. So we should advocate for practice. That's just a thought that I had. I don't know if there's any thoughts from the floor on that.
Rina, do you want to respond, seeing it was your question in the first place, to what Lizemari suggested?
Thank you, Sue. I think that's a very good situation that she explained. And I think collaboration, as Lizelle also said, I think that would help. But that's quite a challenge, because you have got studies that's being done, but because of the fees, it cannot be published. But thank you very much.
Oh, thank you.
Sorry, Sue, if I can add on that, we need to, from an academic point of view, we have to be very deliberate in our funding then, to see how we can secure funding for our projects, and the type of projects that we write, projects that will actually fall within the call of fundings. So we can maybe also look at that to help, and then incorporate publication fees as part of the proposal that we are writing. That's also one idea. It's not a new idea, but it's just an idea.
Yeah, thank you. And I think your idea of trying to set up some sort of, I can't remember what you called it, research units within hospital-based research units, I think you referred to, or health establishments research unit, that might resolve quite a lot of the problems with regard to application of knowledge. Because I agree with you. I mean, I have, like you've indicated, lots of students who've done some really good research, and then it just sits on the shelf. So my next question is, what can we do to encourage the application of the findings? Because the people who generate the knowledge initially as students are not necessarily working in the unit where it would be most applicable.
Okay, so there's two thoughts. Okay, let me skip this one. Let me answer yours first. So if they did a study in a unit that they didn't work in, why did they then do it there? Let's say, for instance, they moved away. I think that will create an opportunity to then do, let's say, for instance, implementation science. So implement whatever they found and build on that study. So are you referring to somebody that has published or has not published?
Well, either, but it's happened to students who've published and then, as you say, moved out. I had a couple of students who were actually working in the NGO sector, and then with the Trump funding being withdrawn, they've now moved completely out of that section and sector and don't have the opportunity to apply their findings.
Well, I think if it's still worth writing on, because there's still the Belinda and Bill Gates. I have a friend that's working for them. You know, there's still a lot of NGOs that's still going on. So I think the relevance is not affected depending on the findings, but I think then it needs to be written in such a way that it's applicable to other NGOs, to not lose the value of that study, is to maybe then look at an angle to to make it applicable across, other NGOs, maybe use a global framework or a unified framework or something like that. But, and again, I'm just sort of waffling ideas here. So I think that can be one, because, I think the biggest thing, Sue, the biggest thing is get it angled, get it out, because it's, especially if it's good studies, because data gets old very fast. And there's a thing now on, they don't want data less than 2 years, then they won't accept your article. Although I had somebody the other day, 2 years ago, 2013 data that she got published. I don't know how she did it, but she did it. So, I actually don't have a very clear answer for you.
Yes, I think my concern is going from once it's published to get the buy-in in the clinical areas to actually implement the findings. That is where I think we are struggling.
But I think that is why we need to start the bottom-up approach. First, link with clinical practice, hear their thoughts, identify deliberate things, and then move upwards, because then the uptake, in my opinion, will be better. Instead of, me sitting here and thinking, okay, well, there is this problem, but I also hear the situation of where they actually moved away. Maybe then go to other NGOs and say, how applicable is this in your situation? Can we, I'm not sure.
Okay, it's a difficult
It's very
one.
difficult questions here, and we need
Yes.
to start asking these questions, because otherwise we're just continuing and doing research, and but we're not making a difference. There's no evidence-based practices that's really enforcing nursing sciences. So this is the difficult questions that we need to start asking and discussing. I was actually thinking on something, Sue, was that I think what one should also do is start negotiating for better prices with the publishing houses, to say, well, that there's sort of a clause in that so for instance, if you go to first world country conference, you get a better price because you're from a middle low income country. So something like that but for clinical practice, that they have this special price if it's a good implementation research, that was done in a clinical setting, that you sort of have that then as a negotiation, so that you can get it published, which will then lessen the fees.
Thank you. That's a very good idea. And it also leads back to, on Monday, one of our speakers referred to leading from where we stand. So I think each one of us then needs to think about those sorts of things and try and resolve the problem. So thank you. I don't know if there are no more questions in the chat, whether there's anyone wanting to raise a question. Just put up your hand.
People are very shy.
Yes. Okay, well, we're on 12:59. So Lizelle, I'm going to hand over to you and to say thank you to Lizemari.
So again, thank you so much, Lizemari, for being available and talking to us, sharing the love story with us. And hopefully we will be able to engage together with the love story. I see my screen is frozen. So thank you so much for everybody signing up and joining us and participating. And remember to add your thoughts to the Padlet, and we'll see you tomorrow again. Again, thank you so much, Lizemari. Appreciate your time and your insights.
Thank you. Thank you for having me. Thank you, everyone.
Lizelle, just to remind everyone that it's a different link for tomorrow.
I'll put it in the chat. Thank you.
Thanks, Lizemari.
Thank you, everyone. Have a nice day. Thank you. Bye.
Bye-bye.